Is it too soon for me to consider surgical procedures for aging? I am 46. For 2 years, I've been getting Radiesse in my upper cheeks, Botox around eyes, and various fillers around my mouth. I have recently requested a mini facelift, upper and lower bleph, and cheek implants. Injectables don't help the lower cheek sagging or loose eye skin. My plastic surgeon thinks it's too soon for surgery, particularly lower bleph. Note that I received Voluma in my upper cheeks and Botox around my eyes just 8 days prior to these photos, and Juvederm around my mouth 4 months ago.
Thank you for your question. You're 46 years old and you've submitted several very nice photos to help us understand what your current facial situation is. In your question, you mentioned that you've gotten injectables. You had recently discussed with your plastic surgeon the option of doing blepharoplasty as well as cheek implants and possibly a mini lift. And your plastic surgeon feels that it's a little too early for surgery. Well, first of all, the question of whether it's right or whether your plastic surgeon is right or wrong is really subjective, because everything we do is based on the subjective perception of the patient and what it is the patient is concerned about. A few years ago, I wrote a book called The Fine Art of Looking Younger. And understanding the principles of facial aging is particularly important as you see these changes occur. At 46, there are some genetic components that are probably playing a role. And certainly, I think fillers play a very important role in helping people fill the areas where there's volume loss. Very often, people are afraid of looking overdone, but I always teach my patients that when I do fillers, it's really most of the time to correct rather than to augment. Now, you discussed cheek implants, you discussed blepharoplasty. The one thing that we can't do with just photos is a physical examination. So just to address the question of the mini lift, well, if you look in the mirror and you push the skin upwards, if you have some laxity and it moves very easily, you might be a good candidate for a mini lift. But it might be that when your plastic surgeon examined you, when they pushed on the skin, there may not have been that much movement, at which point it's probably not the best idea. I think that when the photos you submitted, the lower eyelid puffiness draws my attention. Now, yes, I'm an oculofacial plastic surgeon, so eyelids and facelifts are kind of pretty much what I do every week on a regular basis. So certainly I zoned in on that. I think you have to ask yourself, what are the things that really matter most to you? And if you can hold off any procedure, whether it's the cheek implant or the facelift, and you can buy time with fillers, I think that's a perfectly reasonable strategy. From my perspective, I think addressing the eyes would make a significant difference. Now that is based on the photos you submitted and a single time frame. So consider discussing with your surgeon about blepharoplasty and what would be an alternative to the significant amount of puffiness that I see in the photo. And I think that your surgeon may feel that they're comfortable doing the external approach, where in my practice we typically do the transconjunctival approach and we don't remove skin. This is something that is technical and is more about the discussion. I think that the choices, the things that you are considering are reasonable. There's a limit to what fillers can do. So considering doing an upper lid blepharoplasty, a lower lid blepharoplasty, cheek implants, and with or without a mini lift are still within the realm of possibility with the photos you submitted if we were to just look at them, quote, objectively. So I think that if you are not, I'm sure you're comfortable with your surgeon, and so if you want to discuss this again or get additional opinions, I think it's helpful to get educated. And a physical exam can't be replaced. And so learning your options, learning the risks of all the procedures you're entertaining is also very, very important. And it is something that requires a proper consultation. So I think that we were able to cover some basic ideas and principles and understand that it's about subjective perception and what's most important to you. And for many of my patients, when they look at themselves in the mirror, they look at their eyes first, which is why eyelid surgery is such a popular procedure in our practice. So I wish you the best of luck. I hope that was helpful, and thank you for your question.